Hi, I'm Dr. Gregg Carb, and this video is lateral hip pain of the gluteus medius hip rotators, massage ball percussion self-care video. As a reminder, remember to check with your healthcare provider before starting or changing an exercise program. Lateral hip pain can be quite debilitating. There can be several different causes of lateral hip pain, but a common one is strain of the gluteus medius and/or hip rotator muscles. These muscles can be recurrently strained or partially torn and then become a chronic problem. When these muscles are injured, they can cause pain during or after running, stair climbing, squatting type exercises, and prolonged sitting. Internal, external rotation motions of the hip can also be limited and/or painful. So let's take a look at the anatomy of the area for a better understanding of the problem. We are referring to this area of the hip and pelvis. Under the gluteus maximus and wrapping around the hip joint from front to back is the gluteus medius. The gluteus medius can be recurrently torn or strained where it attaches at the top of the pelvic crest, at the junction between the gluteus medius muscle and its tendon, and at the tendon attachment to the thigh bone. Each subsequent tear of muscle or tendon fibers will be filled in with some adhesive scar tissue, which is less organized, weaker, stiffer, and more sensitive than the normal tissue it replaces. Before we explore self-care options, let's briefly review some other conditions that can also cause pain in the lateral hip region. So far, we have been referring to this area, which also partially wraps around the back of the hip and pelvis. Pain in this area, especially with tenderness right over the part of the thigh bone that sticks out, is likely to be trochanteric bursitis. Pain deeper in the hip joint, indicated here, may be a tear of the hip joint labrum or osteoarthritis of the hip joint, which may also be associated with impingement. If you perform self-care for a gluteus medius lateral hip pain problem and don't see at least some improvement in a short time, see your healthcare provider. So for self-care, we are going to first use the massage ball to break up some adhesive scar tissue. The ball should be firm and about the size of a baseball or lacrosse ball. The spikes are optional. Start by laying flat on the floor with the painful leg down and the other leg bent at the knee. Roll off to the side so you can place the ball under your hip in the area of your back pocket. Then roll your weight back onto the ball. Repeat several times in different spots, including the area toward the seam of your pants on the lateral hip. That will have you roll almost onto your side. If you want to stack more of your weight on the ball, place your leg into a figure 4 position and continue to roll slowly back and forth on your gluteus medius and hip rotator muscles. The next self-care tool is percussion, which works like a jackhammer to break up fibrotic tissue. Lay on your side with the painful side up and put a big pillow between your knees. Direct the percussion tool over your muscle and allow the weight of the percussor to rest on your muscle before starting. Be sure not to bounce off your bone at the top, which would be the pelvic crest, or down on the upper thigh bone that sticks out, the greater trochanter. Percuss over several different areas of your gluteus medius muscle and tendon, a few seconds at a time. Finally, using common sense, do avoid or heavily moderate any aggravating activities so your gluteus medius muscle and its attachments have a better chance to heal without interruption.